Hello, my name is Jeanne Sarnosky, and I'll be your host today for Cape Health News, a health information program brought to you by Cape Cod Healthcare. This program is unique to the health concerns of Cape Cod and the islands, and we'll be bringing you stories on health topics of interest to all the residents of Cape Cod. We'll also bring you inside the facilities of Cape Cod Hospital, Falmouth Hospital, doctors' offices, patient homes, wherever the stories take us. We hope you will be better informed about your health and how to maintain a healthy lifestyle for many years to come. But first, I'd like to introduce Mike Loff, President and CEO of Cape Cod Healthcare.
Hi, I'm Mike Loff, President and CEO of Cape Cod Healthcare, and welcome to the show. This is a news magazine, a magazine that will feature incredible stories of health, hope, and recovery. A news magazine that will feature our physicians and the incredible skill that they have. This news magazine will feature our nurses and our techs and our aides and all the healthcare workers that mean so much to the care that we give to our patients. This news magazine will also feature the patients themselves and their incredible stories. You'll learn ways to stay healthy as well as improve the health of our communities. You'll learn about new technologies and new facilities that we've invested in. You'll hear about new ways in which care is being delivered closer to home that's more accessible, more patient-centered, and more friendly. You'll hear about our mission and ways in which we can benefit all of the Cape by investing in you, our patients. We thank you so much for the support that you've given to us, and we thank you for allowing us into your home.
Thank you, Mike. May is Stroke Awareness Month. Did you know stroke is the leading cause of disability in the United States? About every 40 seconds, someone suffers from a stroke. Approximately 795,000 Americans have a stroke each year. Stroke is the fourth leading cause of death. On average, someone dies of stroke every 4 minutes. There are approximately 130,000 deaths each year from stroke alone. About 87% of all strokes are acute ischemic strokes, caused by blood clots that block the flow of blood and oxygen to parts of the brain. This blockage can be life-threatening and debilitating. Acute ischemic strokes strike without warning and are recognizable through a number of signs and symptoms. I spoke with Dr. Michael Markowski, a neurologist at Cape Cod Healthcare, about the signs and symptoms of stroke.
Many people are aware of the signs and symptoms of a heart attack: chest pain, chest pressure, shortness of breath, but stroke symptoms are quite variable, so oftentimes the public are not aware of common stroke symptoms. Stroke typically is evidenced by a sudden onset of symptoms where one side of the body feels different than the other. This can be paralysis on one side of the body, numbness on one side of the body, clumsiness on one side of the body, or sometimes abrupt change in vision or inability to speak. This can be either related to slurred speech or inability to express someone's thoughts or follow commands.
Dr. Michael Leahy is the stroke director at Falmouth Hospital.
Stroke can affect people of any age. The risk is higher as you get older. It is a disease of the arteries, a blockage of the blood vessels, so it tends to go along with other problems with the blood vessels. People with high blood pressure, with high cholesterol, or with diabetes are more prone to stroke. People who have heart disease or blockages elsewhere in the body would be more prone to stroke. But no one is immune from it, no one is safe from it, so stroke can affect anyone.
At Cape Cod Hospital alone, we will see 60 to 70 admissions for stroke or TIA every month.
A stroke is a sudden change in brain or neurologic function caused by a blockage in a blood vessel. We use the acronym FAST, F-A-S-T, face, arm, speech, and time. And some of the things you can see with a stroke are weakness of the face or face becoming asymmetric. You can notice a change in speech where speech gets either harder to get out words or harder to pronounce words. Or you can see a change with the arm, a limitation of arm strength that goes along with a stroke. The last part, the T for time, is to remind people that if they get to our emergency department quickly, we may be able to reverse the stroke by dissolving the clot in the artery. Not everybody is eligible for this treatment, and it needs to be done in a relatively short period of time. The shorter the better, and never beyond 4.5 hours. If you come to emergency here with symptoms of a stroke, we will rapidly evaluate you, try to get a CT right away to see if it is something different from a blockage in a blood vessel, and then consider whether we would use a medicine called tissue plasminogen activator, TPA, to dissolve the clot.
Stroke is a medical emergency, and that is something we have to make the public increasingly aware of. And I think as a healthcare profession, we haven't gotten the word out in terms of this being a medical emergency like we have for heart disease and some other disorders. The reason why stroke is a medical emergency is we only have one approved treatment by the FDA. There's one medication, it's called TPA. TPA is a clot-busting medication, and it can be given safely to patients with an acute stroke in upwards of 4.5 hours, or in patients over 80 years old, it can only be given within a 3-hour window from the onset of stroke to our ability to deliver the medication. Even though this is the only medication available for acute treatment of a blockage of a blood vessel to the brain, what we call an ischemic stroke, it's only given to 5% of patients nationwide. And the number one reason why this medication cannot be given is people go to the ER outside the 4.5-hour window.
Sometimes patients with stroke aren't aware of what's happening to them, and it's more evident to those around them. And a lot of times family members or friends are the most important part of getting folks involved in treatment very early.
So the difference between TIA and stroke is the duration of symptoms. Historically, when I was training and in medical school over 10 years ago now, the definition of TIA or transient ischemic attack is what TIA stands for. And the definition of that were neurological symptoms that came on and got better in 24 hours. Now we know that most TIAs last 5 to 10 minutes, and if symptoms persist beyond 30 minutes or an hour, that even if symptoms went away, eventually, when we check a brain MRI, we will see a permanent injury or a small stroke in that part of the brain. Medications such as aspirin, Plavix, and Agrinox will reduce the risk of another TIA or stroke by anywhere from 25 to 30%. Then we have to modify the risk factors so this does not happen again. High blood pressure, high cholesterol, diabetes, and smoking.
In our next segment, we'll learn about getting some fresh air and exercise in one of the most beautiful places on Cape Cod. We'll be back to talk about the Healthy Parks and Healthy People program, a collaboration between Cape Cod Healthcare and the Cape Cod National Seashore.
Urgent care centers are very useful for when you have an acute problem that really can't wait, perhaps a fracture, a sprain, bad urinary tract infection, a tick bite even. You may want to access one of our urgent care centers. Probably don't need to go to the hospital for those, the emergency rooms. This is a great alternative.
Introducing Cape Cod Healthcare's Heart and Vascular Institute. We've combined a team of top cardiac and vascular physician specialists with the full resources of Cape Cod Healthcare. We've invested in the latest life-saving technology. This unprecedented partnership means that you and your family will get the best cardiac and vascular care. The Heart and Vascular Institute at Cape Cod Healthcare. Expert physicians, quality hospitals, superior care.
This is a perfect place for all the minor urgent care center problems that we see, such as lacerations and urinary tract infections and colds and minor injuries and fracture care. But don't come here if you've hit your head on Coumadin and fallen down 2 flights of stairs or fallen 20 feet off a roof. Trauma is better handled at the emergency department.
Welcome back. In this segment, we're going to introduce you to a new partnership between Cape Cod Healthcare and the Cape Cod National Seashore. It's called Healthy Parks, Healthy People. Swimming, hiking, biking, kayaking, surfing, and walking are just some of the ways to enjoy the National Seashore. It's about making exercise fun, both physically and spiritually. This partnership has mobilized a diverse team that includes Cape Cod Healthcare physicians, physical therapists, nurses, marketing specialists, and volunteers, along with park rangers, scientists, and staff. They have also involved an entire class of sports management students from Johnson & Wales University in Providence to help research and help develop the program. I spoke with Dr. Alyssa Thompson, a cardiologist from Cape Cod Healthcare, in the beautiful museum at the Salt Pond Visitor Center.
This is such an exciting program for us to be involved with, and we're so excited that the National Park System and the National Seashore have asked us to be involved in promoting health and well-being for Cape Codders out in the Outer Cape and the Lower Cape, and to be outside and use our beautiful natural resources to prevent cardiovascular disease, which of course is the #1 killer of people. So what we're trying to do is encourage people on Cape Cod to use the National Seashore and the beautiful trails that they have here to promote health and well-being and to promote people to get outside. And we're going to be monitoring the progression of people's exercise here throughout the summer months with blood pressure screenings, and we're hoping to incentivize our folks out here with some treats and prizes to get everybody out and everybody moving on Cape Cod.
So do we have evidence that something as simple as walking can improve someone's health?
Absolutely. We've known for at least 40 years that exercise is the easiest and simplest way to lower your blood sugar, to lower your blood pressure, to control your cholesterol, to promote health and well-being of your vascular system. It improves your heart's health. Anything that you can do at any point during the day where you're moving all 4 limbs at the same time in a purposeful way is going to help you stay better and healthier longer.
I understand you've put a program like this together before with great success for the health of the people that were in the program.
Actually, we have. When I was a cardiologist in Texas, most recently, I initiated a walking program in a small town where I was seeing patients. We also had beautiful countryside at our disposal, but no one was using the great facilities and the beautiful parkland that we had. So I sat out in my parking lot with a free batch of coffee to whomever would come, and I checked blood pressures and had people getting weighed and getting prizes, and we did it every Saturday for 2 years. I had about 200 patients that were following up with me on Saturdays doing the walk. So it's a great way to get the community out, not just for people who are patients who have heart disease, but for people who are interested in promoting their own well-being.
George Price, superintendent of the National Seashore, explained to me how it came to be. George, tell us a little bit about the Healthy Parks, Healthy People program as part of the National Park Service.
This is an initiative that the National Park Service has really embarked on several years ago as we were approaching the millennium, as we're approaching the centennial of the establishment of the National Park Service, which I'm a member as a National Park Ranger. There were many, many tasks and projects and events and activities that they asked parks to consider, and the Healthy Parks, Healthy People initiative was one of them. And some of our colleagues down in the National Capital Region around the mall on DC and a number of the parks in the neighboring area really embraced it. So over the last year or so, they've actually had a very ambitious program. I've learned that our colleagues at the Blue Ridge Parkway have done a lot of things, especially with children. And for a lot of reasons, it seemed like it was a good idea to do it here on Cape Cod.
How important is it to have Cape Cod Healthcare, a regional healthcare system, partner with you on the Healthy Parks, Healthy People program?
Well, I think it's very important. Obviously, we could go off on our own and we could divine what these trails might do for you from a health perspective, but it's very important to have professionals involved. Obviously, we're encouraging visitors to embark on aggressive type walking for their cardio wellness and their general overall wellness, but we don't really have that expertise, so we need professional expertise. In addition, it's important for us to partner with large regional organizations on Cape Cod. We have 44,000 acres here in the outer Lower Cape, and we have almost 4.5 million visitors a year. Some of our visitors end up at Cape Cod Hospital. Some of our employees, like myself, end up at Cape Cod Hospital. So it was a natural outreach, and the hospital executive staff has been very supportive. And I was just really thrilled about the opportunity to partner. It seemed like it really was the right time for this to come together.
So is this something that will continue for some time, and this is people sign up and participate for months to come?
Absolutely. We're going to be out here from June to at least October, and we'll be starting this year, but with a plan to follow up with at least 2 more years after this. We will be monitoring people throughout the summer. It's a volunteer program. Obviously, if you want to come out and track your progress, we'll monitor how many miles you've walked, how many days you've walked, what your blood pressure looks like both before and after you exercise. We'll monitor your weight if you'd like us to, all with the incentive for you to understand how exercise can improve your health and well-being overall.
Coming up next, we'll discover how technology has changed the face of home care.
Hi, this is Dr. Burke. I'm one of the emergency department physicians that works here at Sandwich. Both facilities are staffed by emergency department physicians, which I think gives us an advantage over the other urgent care centers in the community. We also have an excellent nursing staff, and we also have great nurse practitioners and physician assistants to help us in this endeavor.
Vascular diseases and vascular surgery now requires really a multidisciplinary approach.
The team approach at the Heart and Vascular Institute allows us to work together for each and every patient.
The surgeons and the cardiologists and the interventional radiologists and vascular surgeons will all work together on one patient to collaborate, find out what's the best procedure for them.
The nice thing about a system like we have here at Cape Cod is that the patients are always under the direct care of the senior attending physicians.
It's not that we're just doing procedures here. We're really trying to, take care of the entire patient. So in helping them improve their lifestyle going forward.
We are positioning ourselves in a way that will best serve the community, our community.
The Heart and Vascular Institute at Cape Cod Healthcare. Expert physicians, quality hospitals, superior care.
Cape Cod Healthcare has developed the Fontaine here in Harwich and also the Stoneman in Sandwich. Both places are to be there for your acute care needs, especially if your doctor's office is closed or perhaps they're too busy to see you on the particular day.
The Visiting Nurse Association of Cape Cod has been in existence since 1916, soon to celebrate its 100th anniversary. It's one of the oldest nonprofits on the Cape. After joining Cape Cod Healthcare in the 90s, it became apparent an investment in technology would be necessary to keep up with the growing demand for home care services. I spoke with George Hayden, Chief Information Officer at the VNA of Cape Cod, about some of these technological changes. So, George, why is technology so important for home care?
Well, back in the late 80s and early 90s, when patients started going home faster and the 2-week stays at the hospital were over, home care experienced a major uptick in the number of patients that needed care at home, from everything from skilled nursing to therapy to social work and to paraprofessional help, which is where we take care of the activities of daily living and get the patients back to their wellness goals. So back then we were on paper. We had this huge uptick in volume. We went from about 50 caregivers in the home to over 500. So we had paper everywhere. We had every nurse and therapist and paraprofessional had an in-basket overflowing with paper. They needed a desk, and that model was just not sustainable. So we decided to make the move and put our dollars into technology at that time. That was back in 1995. So we're celebrating almost 20 years of using technology in the home. And we gave all of our caregivers laptops. And this enables our staff to stay in the community, visiting patients instead of driving back and forth to an office. They get their schedules remotely. They all share the same patient record, so they know the nurse knows what the therapist is doing with the patient and vice versa. And everything is done electronically, and we can also communicate with the physicians electronically.
So how does technology improve the coordination of care?
The coordination of care across the continuum is the big challenge, and using an electronic record helps us do that. We are able to communicate with the equipment that we have. We can communicate not just with each other, but also with the physicians. And so we do a lot of neat things with the technology that we have in place right now. Everything from taking digital photos of serious wounds, sending them to physicians around the Cape and up in Boston, and coordinating with them how we're going to attack that wound and get it better for the patient. We do the facility discharge summaries from the hospitals and the nursing homes are all made available on the laptops to our nurses and therapists, so that they know what happened in the hospital before they go out to the home and visit the patient. So we get a heads up on what the patient has been experiencing while they're in the facility.
The VNA of Cape Cod has been using telehealth or telemonitoring since 2005. It is used as a standard of care for patients challenged with coronary artery disease, heart failure, high blood pressure, COPD, pneumonia, asthma, and bronchitis. I spoke with Kathy Rowe, Director of Home Care Services at the VNA, about telehealth. Are there typical patients that have the telemonitor in the home?
Well, when the nurses go out to evaluate the patient on their first visit to admit them to VNA services, what they're looking at is those patients that may be at high risk for rehospitalization. As I said, we want to keep patients in their homes. That's our goal. And so by using telemonitoring, we can identify those patients who are typically at high risk, such as the heart failure patients, patients that have had pneumonia, patients that may have been hospitalized for any other chronic lung issues, and somebody who may have just had a heart attack.
So is it difficult for a patient to use?
No, actually it's very easy. In fact, the monitor itself walks the patient through the steps every day. The patient, we like to have the patients transmit their information early in the morning, first thing, before they eat or drink or get dressed. We want them to be in the same clothes every day so that their weights are pretty consistent when we're having a baseline. And so they're able to just sit down, pick up the monitor, they can put on their blood pressure cuff, they get on the scale, and the monitor will actually walk them through whatever the stages that they need to go through.
So it actually talks to them?
It does talk to them. And it also records it. It's in writing also. And it will not only ask them or show them how to go through the different vital signs, but it will also then do some patient education, give them some education specifically on their disease process.
Will consume more sodium than their body needs.
The list of possible uses for telehealth continues to grow, and patient demand is expected to increase with it. When we return, we'll learn about ways Cape Cod Healthcare reaches out to our community with valuable information directly from the experts.
Our urgent care center, because it's staffed by emergency physicians, emergency nurses, can really handle a lot of procedures. We're very comfortable with lacerations, abscesses, splinters, simple fractures. So we really have a fairly wide range of what we can do out here in terms of proceduring.
Every patient's needs, every patient's requirements are different, so doing the right procedure for the right patient, that's really what this is all about.
Every patient we see is somebody's husband or wife or child, and we try to take that into consideration, whether it's 2 in the morning or 9 in the morning.
There's really very few things at this point in time that a patient can't receive here, either from a diagnostic or a therapeutic standpoint.
If the patient knows that he can get the best treatment close here to home, where his support system lies, I think it's a huge, huge advantage.
We are a heart and vascular institute that will be recognized throughout Massachusetts and New England for the outcomes and the personal care that we're able to deliver.
It's not just a community hospital. In many ways, it's a major medical center in a community setting.
The Heart and Vascular Institute at Cape Cod Healthcare. Expert physicians, quality hospitals, superior care.
The one thing that we find urgent cares in general, and ours included, aren't very good at it. We aren't very good at evaluating abdominal pains, chest pains, things that require blood turnaround in real time, higher imaging such as MRI, CAT scan, ultrasound. So that's where urgent cares start to become differentiated from an emergency center, is that we just can't work those things up in real time as effectively.
For several years now, Cape Cod Healthcare has offered educational seminars to the public at various locations around Cape Cod. These educational seminars have been developed to give the general public an opportunity to hear firsthand from our experts about a wide variety of health topics. Dr. Paul Houle of Neurosurgeons of Cape Cod is one of those experts. He's been giving seminars to the public for almost 10 years. So Dr. Houle, why did you start doing these seminars for the public?
Well, initially it was purely selfish. I wanted to get our message out to the community that we provide very high quality care that equals or rivals Boston. But then as the years went on, I realized that there was such a lack of understanding and knowledge out there. I mean, there's a lot on the internet about back pain and neck pain and all the different procedures that we do, but there's also a tremendous amount of misinformation. So I found myself, when I was counseling patients, really starting to teach them about what their problem really was and try to dispel some of the myths that they learned on the internet.
What has the response been from your patients?
Well, I think it's been overwhelmingly positive. Patients have come to see me and say at the end of their visit, oh, by the way, I went to your seminar such and such a time and I found it very informative and that's why I'm here. So I think it gives patients a chance to sort of see who I am, who my partners are when they give their discussions, and they get to feel comfortable with our philosophy on how we treat patients. Well, think of the question was, do you have pain down your leg? It doesn't really happen in your back, but you feel it down your leg into your foot.
I was a previous patient of Dr. Houle's and wanted to get some more information. These seminars, you do come away with a level of comfort knowing that you're about to have surgery. And you come away being armed with more information, which gives you that level of comfort. The seminar, I believe, was in November. My surgery was in February, late February. I ended up having a laminectomy with a fusion, a mechanical fusion. Was joking earlier that I'm off home confinement now, so I'm able to get about. We're going to start PT here shortly, but I feel pretty good. The pain that I was experiencing earlier is gone.
Another physician from Cape Cod Healthcare who gives regular seminars to the public is vascular surgeon Dr. Paul Scudder.
Well, what we're trying to do is share some information about how problems with the veins can affect their lives and what kind of symptoms it might give to them. We're trying to share with them some information about what procedures and what treatments might be available in order to help them with that, because most of these things can be helped with relatively minor treatments that are very simple from the patient's viewpoints.
Well, I'm here because I really wanted to know how to manage the pain that's in my leg. I don't know what to do, so that is why I'm here. I'm going to try to hopefully get some good advice and be able to manage the pain and hopefully not be able to have it anymore, really is, I think, my goal.
Well, I think the real target is the community members who aren't necessarily in our office and aren't necessarily getting care from us already, but we're trying to help people understand what services might be available and how it might be helpful to them.
I do have a healthcare provider, but a specialty doctor like this would be somebody that I don't really get a chance to maybe speak with if I only have maybe one question. I don't feel like I could really maybe make an appointment. I didn't have an appointment's worth of how can you help me. I just have one simple question.
Thank you for joining us in our new TV show. We hope you found this to be informative and helpful in your pursuit of good health. Until next time, I'm Jeanne Sarnosky wishing you good health and good health care.